Hi there, myself Dr. Amrita Krishna. When I was preparing for my exams, I always wanted a short, crisp list of volatile topics that I could quickly revise just one day before the exam. And one major part of that was always the new drug high yield list. And this list is made mainly with INICET in mind, but such questions can appear in any PG entrance exam. In fact, this year's NEET PG 2025, there was a direct question on benralizumab, which is an interleukin-5 receptor antibody. So these are not limited to one exam, but we can expect them anywhere. So that's why I thought of sharing this exam-oriented new drug list with you today. So let's quickly revise the list of new drugs. I will try to explain the way I actually try to remember them. The first one is tesamorelin. How I remember is Tessa is a fat girl with HIV. So tesamorelin for HIV lipodystrophy. Then mecasermin. Meca is, remember mega. Mega is turning into minimum. Mecasermin. So mega into minimum. That is, somebody is turning into the minimum version, that is Laron dwarfism. It's a recombinant IGF-1. The next one is TNF-alpha inhibitors, anakinra and tocilizumab. We commonly learn during our UG days. The anakinra A is the first letter of English alphabet, and remember interleukin-1 receptor antagonist. Anakinra for interleukin-1, first letter. Then TNF-alpha inhibitors, these are infliximab, adalimumab and etanercept. Interleukin-6 receptor inhibitor is tocilizumab. Try to remember. Then I do feel that this is important and this could be a potential question. Ustekinumab is interleukin-12-23 inhibitor. It is used in psoriasis and IBD like Crohn's disease. Then secukinumab is, remember secu for 17, okay? Secu for 17. It's used in psoriasis and ankylosing spondylitis. Remember psoriasis at least. Then teplizumab for type 1. Teplizumab type 1 diabetes. Those names are resembling, right? Then belimumab for SLE. Beli SLE. Somehow try to remember. Now coming to the neurology. How I remember omavelaxolone for Friedreich ataxia is fried egg is omelette. Fried egg omelette. So it's not omalizumab. Omalizumab is for asthma. This is omavelaxolone, which is used in Friedreich ataxia. Then ALS drugs are RET drugs. ALS RET drugs. Riluzole, edaverone and tofersen. Riluzole, edaverone and tofersen. Myasthenia gravis drugs. How I remember the drugs used in myasthenia gravis may sound silly, but I'll just share. Zilu is a girl and Ghar means house, right? So Zilu is a girl, goes out of her house. Rose means daily. Rose, night. Ratri. Ratri means night in Malayalam. So Zilu goes out of her ghar. Rose, Ratri. So Zilu, Coplan, F. Gatigimod, Ravulizumab, Rosanolixizumab. So these are the drugs. And one extra drug is eculizumab. How can we remember? This is a drug which is used in both PNH, paroxysmal nocturnal hemoglobinuria and myasthenia gravis. So the next one is SMA, spinal muscular atrophy. Which are the drugs? Nusinersen, Risdiplam, Zolgensma. These are the three drugs. Nusinersen, Risdiplam and Zolgensma. So coming to the hematology and clotting. Hemophilia, I remember this by some silly mnemonic again. Amy is a girl, she's concise, she's a small girl, okay. Amy is a concise or small girl. Kanzizumab and emicizumab. But she's fit. Why she's fit? Because she's doing martial arts. Marstazimab and Fitusiran. So Amy is a concise girl who is fit due to martial arts. But whenever she get a hit, she'll developing hemarthrosis because she is having hemophilia. So for hemophilia, the new drugs include emicizumab, kansizumab, fitusiran and marstazimab. Coming to the next one, these are important. Dabigatran reversal, which is the drug. What is dabigatran? It's a direct oral anticoagulant, direct thrombin inhibitor. So the drug which is used for reversal of dabigatran, idaruzumab. Okay, idaruzumab. So reversal of dabigatran, idaruzumab. The next one is reversal of apixaban and rivaroxaban, direct factor 10A inhibitors, which is andexanet alpha, 10A, apixa, X. What is X? 10, right? X inhibitor, 10 inhibitor, andexanet alpha. So that is the reversal agent. Then something which is used for reversal of most of the directly acting oral anticoagulant is siraparantac. This is in trial. Siraparantac is a new drug which is used in reversal of anticoagulants. Coming to the oncology part, cyclips are some drugs which are used in breast cancers. Okay, palbociclib, valociclib. And these are CDK4/6 inhibitor. What is CDK? Cyclin dependent kinase. Easy, right? Cyclips are used as inhibitors of cyclin dependent kinase in breast cancer treatment. Coming to the next one, olaparib. This is a May 2025 INICET question. It is PARP inhibitor, which is used in BRCA, ovarian and breast cancers. parib. Easy, right? PARP, PARP, olaparib. The next one is cetuximab and panitumumab. Cetuximab and panitumumab. These are used in colorectal and head and neck cancers. We usually learn them when we learn surgery. Colorectal cancer, one new monoclonal antibody is cetuximab. Remember CC. Then anti-VEGF antibodies, we know these are used in diabetic macular edema also. So bevacizumab is an anti-VEGF. Anti-HER2, which is used in HER2 new positive breast cancer, is trastuzumab. Coming to the next one, daratumumab. Daratumumab is used in multiple myeloma. Remember Dutcher body, where we are seeing Dutcher body? Yeah, in multiple myeloma, plasma cells inside the nucleus. Like Dutcher body, daratumumab. Somehow correlate and remember. Then immunotherapy, we have some drugs, nivolumab, pembrolizumab, ipilimumab, durvalumab, atezolizumab. Coming to the cardiology part, we have a very short-acting beta blocker, esmolol, right? Like esmolol, another drug is there called landiolol, which is an ultra-short-acting beta-1 blocker, which is used in arrhythmias. So this is having shorter duration of action than esmolol. The next one is vonoprazan. Vonoprazan is a potassium competitive acid blocker, PCAB. It is used in GERD and peptic ulcer, and it is found to be superior than pantoprazole in recent studies. The next one is Duchenne muscular dystrophy. What are the drugs? Eteplirsen, casimersen, golodirsen. Try to remember. Just revise one day prior. Lipid disorders, we have some important drugs. Mipomycin, which is used in familial hypercholesterolemia. And evolocumab, which is PCSK9 inhibitors, which is used in hyperlipidemia. Don't confuse between these two. We have PCSK9 inhibitor and PCSK9 synthesis inhibitor. The PCSK9 inhibitor is evolocumab, whereas PCSK9 synthesis inhibitor is inclisiran. Don't confuse, okay? Then we have bempedoic acid, which is an ATP citrate lyase inhibitor. I do feel that this is a potential question. Bempedoic acid is ATP citrate lyase inhibitor. Coming to the next part, asthma and allergy. We have omalizumab, which is an anti-IgE antibody. Then interleukin 5, anti-interleukin 5 antibody is razilizumab and mepolizumab. The question which was asked in NEET PG, which was that? Benralizumab. Benralizumab is an anti-interleukin 5 receptor monoclonal antibody. The next one is dupilumab. Dupilumab, double, okay? Double. So remember 4. So 4, interleukin 4 receptor. Then tezepelumab, which is an anti-TSLP antibody. Now we have Fomiversen. Fomiversen is a drug which is used in CMV retinitis, but it is obsolete now because we have other drugs. Then daprodustat is used in CKD anemia. It is a hypoxia-inducible factor prolyl hydroxylase inhibitor, daprodustat. This can be a question. Then palivizumab. Palivizumab is used for respiratory syncytial virus. Remember, palivizumab is used for respiratory syncytial virus. Then for migraine, we have some drugs. Eptinezumab, fremanezumab, galcanezumab. They are anti-calcitonin gene-related peptide drugs. Try to remember, they could be asked. Denosumab is used in osteoporosis. It is a rank ligand antagonist, anti-rank ligand. The next one is very important drugs. Alzheimer's disease. Which are the drugs used? Aducanumab, donanemab, lecanemab. All of these are potential questions. If you remember any other drugs than those which are included in this list, kindly comment below and let us all learn